Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. I'd like to welcome Dr. Shideh Shafie and Amber Pena Posey. Thanks for joining us today, Shideh and Amber.
Hi.
Thanks for inviting us.
Yeah, glad to be here.
Yeah, me too. Yeah, and you're very welcome. So by way of a brief introduction, Dr. Shideh Shafie is an emergency medicine physician and a performance coach for executives and leaders, empowering high-achieving professionals to reach their goals while maintaining their standards and balancing family life. And I'm absolutely sure you are amazing at doing that. And Amber Pena Posey is a psychiatric nurse practitioner by training. And your tagline reads, I empower rebels with a cause, merge your helping profession wisdom, entrepreneurship prowess, and rebel heart to create bigger impact and income as the healers humanity needs without burnout or staying in a limited box. And that is awesome too. So I'm so happy to have you both on. You're both super cool, and this is going to be amazing. And today, one idea of something we can talk about is your professional experiences that led you to coaching and your unique coaching styles. Both of you coach more than physicians, and you both include the word empower in your tagline, empowering high-achieving professionals to reach their goals and empower rebels with a cause. And you both have such interesting perspectives to share. And if we get a chance, I'd actually like to dive into the word woo, which I didn't tell you, but if we get a chance, I'd like to talk about that. So as we get started, I always ask what you'd most like our audience to know about you as we begin our conversation. Shideh, would you like to go first?
Sure. I mean, first is like, I'm a normal human. I think a lot of times people think that people who do these like coaching stuff were like somehow supernatural. I got kids, I have twins, I have like a regular life, and that I just like really believe that people have a lot more power than they think they have. And when you can tap into your source of power and energy in your life, like you really can get a lot done. And it's not because you don't have enough time, it's because you probably don't have energy and everything feels draining. So I like to remind people that like, yeah, it's I've got 2 kids, I've got a busy husband. You can also make room for the life that you want.
That's great. Thanks. And Amber, what would you like us to know about you?
Yeah, I love that she just said that because I agree. It's like human first, and much like her, this idea of I used to say high achieving helping professionals, and then I realized it's rebels with a cause, because that energy is achievement from an empowered space of letting go of what you need to let go of, so you can really reduce those energy leaks, and your focus and energy is what kind of fills you up, lights you up, knowing your values. And that can feel hard in a world that kind of wants you to stay the same, but it really is, it's like the magic key to really becoming rooted and rising at the same time, right? So that part where you rise up to your potential, your capacity, but really rooted in your humanity and in what calms you, what soothes you, and knowing your values, so that you're not doing it from an achievement model, but from a true like values to achieve what you want versus maybe what society says.
Yeah, that's great. Thank you so much for sharing that. So Shideh, would you like to go first and share a little about how you came to coaching and how you've evolved into including the word empower and having that really, represent your coaching style?
Sure. I mean, my own first experience with coaching were after I had a really bad head trauma. I fell the day after my wedding, had a massive head trauma. This is a doctor and healthcare professional audience mainly. There's a lot of it. I had a subdural epidural pneumocephalus, air in my brain, not good. And so I came back to work. I was an intern in emergency medicine, and I was like, I'm just gonna work through this by working, like not work through the like trauma of having that happen to you. And like everything felt unfair, right? Like that was not supposed to happen. And then I also had 5 years of infertility. That also felt unfair. And that's when my mom was like, you got to hire this person. I met them. They're really good. And that's what I kind of learned about this ideas of like living in victimhood, living like everything's unfair. Everything's happening to me. I have no power. And this man blew up my mind. I was like, that's not, he taught me about neuroplasticity. He taught me about different ways of sort of becoming and much more in this like conscious awarenessness and like recognize how powerful I was. And so that was actually, now I'm thinking about it now, is it wasn't just impactful in like my marriage and feeling better, but like, you know, like my first year as a fellow, like part of my first year through my fellowship, they hired me as a senior executive on our operations team. And like, I went up that rank really quickly. You know, it was like very good. It was very fun. So like, I think it like let me know, like no one has to give me permission to say things. I just have to say them and do the right thing and make things better. And then that's fine. And I can do that. And so that was fine. Didn't really, and then I was like, I took his class, learned how to coach. But I was like, I was like killing in my career. And I was like, you know, this is for when I retire, I'm going to come back to this and I'm going to use it to teach people how to have like happy marriages. That was like what I thought I was going to do. And then, you know, years went on, COVID happens, like everyone in the air is just like disintegrating, so sad. And I was like, oh, I know what to do here. Like, we don't have to disintegrate. Like, yes, this sucks. There's a lot of challenges right now. Like there's the early Lysol COVID. This is like Lysoling the male COVID times. And so, so I like just put together all this programming and I was like, oh, people really need this. Like these people need me. And so then it just sort of evolved from there. So I was like, okay, I'm going to do this and help people because doctors are suffering. And then it kind of blew into like, I realized that there's a lot of people in a lot of other industries that are suffering. People started reaching out to me from other industries. And so then that sort of evolved into my work as I help people sort of figure out how much power they have. And yeah, we all live stressful lives. Stress is part of life. Don't be scared of it. Like use it to empower yourself.
Yeah, that's terrific. Thanks for sharing. And Amber, if you'd like to speak to anything Shideh said, and then go on and share your
Sure.
story.
Yeah, no, I love it because I agree. This one of the things that I think in our healthcare world is it is more disempowering instead of empowering. And so when you're getting shaped in your profession, you're taking, unfortunately, a bit of a victim mentality. And it can feel like where there's a part that's like it's helps with understanding the suffering. And at the same time, our role is to not kind of collude with that and also not to be fixers, right? But to like hold space and help people empower. And so I think we're like taught a certain way, we might think a certain way. And then like when the rubber meets the road, you have to start seeing where you are disempowered in a healthcare profession. And so I noticed I was really cognitively very aware of so many things that were helpful and that were empowering. Working in mental health, I worked with eating disorders. So there is very much an energy of the world is happening to me and wanting to control things. And so helping them harness like actual power versus control was really fun and exciting to watch. And at the same time, just kind of coming up against that I was feeling more disillusioned with staying in healthcare. Not that I think that we don't, I mean, I do believe we need healthcare. I believe we can't just completely have it fall apart too. I think, you know, foundationally there needs to be some changes, but realizing that for me, after about 20 years of working in this field, feeling like I want to meet people at a little bit of a higher level when they're ready to say I can thrive versus kind of getting from crisis, stability, and then thriving. And still, even people who are thriving, there still tends to be like a fallback into victimhood at a lot of times. And so what I see is a lot of forced performance productivity that kind of looks productive and looks high achieving and looks accomplishment. But what really happens is, like she just said, like you're going to have stress. So how can you make it use stress and really let it be part of the fuel, but also letting go what is actually not in service to you. So that when you, especially if you're working in, say, healthcare, right? And I'm at the point where I felt burned out, the moral injury tied to kind of what's happening in society with healthcare. But really full circle, I could go back, start my whole practice over again, feel fine doing it. It's more of really wanting to help people in entrepreneurship, in high achieving fields that are usually using that force fuel instead of the regenerative fuel of power, and releasing, again, the kind of collective illusions and delusions, in my opinion, of what is success, so that it is really matching your values, it's aligned, and you don't run out of energy.
That's terrific. Thank you for sharing, and I'll have Shideh comment on that. And then also transition into something is in other episodes I've said something where we just like call a spade, right? So there's some doctors who still think coaching that even use the word woo, right? And that's just not, they haven't been willing to explore it, or they don't think it would help them. And I think if it's more like, you know, like the type A people or type 1 people, right? And you're just so academic in your thinking. And I tend to be like that myself. So I can fully understand that. And I thought I'd share a specific example is when Amber, when you sent me that exercise to do, and I'll have you after Shideh speaks, I'll have you speak a little bit to it to describe it, you know, better than I can. So I was like, okay, because, you know, I like you, I'm willing to do it. I know you're just trying to help, right? So I went through all of the steps and it came out with some words. And then after that, I was supposed to do something like either, you know, movement or write something down or some kind that tied it all together. And at first I was like, I can't think of anything, right? But a couple of things that came up for me was a couple of my favorite things to do is walk on the beach and talk to doctors. And I was like, how can I combine that? But then somehow it just came to me that of making like these sea glass hearts, you know, for my doctors. And I love it because I had stopped doing like crafty things because I'm so busy doing this. So it filled so many needs. Like it fills my heart and I write something special on the back. And then when I see my doctor and the few I've given it to so far, you know, they've really appreciated it. So I just think it was really cool and that we have to be open to things in that it really, really can make a real difference. So Shideh, go ahead.
So first, I love the thing that Amber said about the regenerative power. That's like really important because like we want to win at life. Like I want to win. I want to win at everything. I want to win at tennis. I want to win at money. I want to win at life. I want to win at marriage. Like I love winning. And if you are if you're just using like forced energy, like that, it's hard to sustain that forever. So like it does need to be something that like you can restore or regenerative. And to speak to the woo, if anyone has met me, like I have a woo side that's very deep, but like my coaching style is not like cuddly or soft. And you know, and I'm an academic physician, right? Like I am kind of the super type A, academic Ivy League physician. Like doesn't get more type A than this. And it's funny because people will come to me and like they have a narrow goal. You know, I have a client I'm finishing up with soon. Like she came, she's an academic physician, not local to me or anything, and her goal was to improve her boards. Like she was worried about her boards and she wanted to like really focus on it. I was like, okay, we'll start with that. But like we've been working together 5 months, but like we've built out a full plan of many things, and you get metrics from me. It's not like we're just like, oh, like how do you feel? Like I'm like, did you do this thing? And then, you know, so she's made a massive financial gain recently. She's had a job promotion. She has started exercising. She lost 15 pounds. Like she's done all these other, and she's like killing her board prep has been indicates that she's going to pass. And so like, it's not like we like notice like one part of suffering and we think like, oh, like, am I hiring a therapist that's going to cuddle me? And there's nothing wrong with therapy. I think therapy is great, but like coaching is not super woo, at least the way that I do it. It's also very metrics driven. Like get your shit done, like get your head in the game. Let's like fix your whole life. And you can, and the one thing I think that is really a hard challenge for physicians specifically, and maybe others, but like I have noticed a lot in physicians is that they go through residency and so and medical school, and it's this sort of like silo where you turn everything else in your life off and you're just supposed to focus on building your career. Great for the 8 years that lasts or longer, right? Like depending on what kind of residency you do, that might be fine. But you got to develop the rest of your life too. Like that's not how life works. You can't just develop your career and then everything else falls into place, right? Like if you want to be married, you got to develop that. If you want to have a relationship with your children and want to have kids, you got to develop that. You want to understand what's happening to your money, you got to develop that. Like you can't just expect a 401k to be like the only thing that you know about. If you want to not be overweight and be health and exercise, you have to develop all those skills. Relationships and friendships, they require energy. Like a lot of people who go through training, they make their friends in medical school and residency, and then there is no further development and it's just focused on career. And that's a mindset that has to change. Like it's not it's maybe you can do that for the 8 years of training, but you can't do that for the rest of your life, like, because the rest of your life will suffer. So you'll have like one massive right bicep and the rest of your body will have no muscles. And that right bicep is the career muscle. So that's a lot. So we put metrics on everywhere else of your body also, and make sure that you lift heavy everywhere.
Yeah. That's great. Thanks, Shideh. That reminds me. So last night I was talking to Dr. Michael Hurst, and he said to tell you hi. And as people know, he's my physician coach. And I know sometimes I just want to, like you said with that woman, like you just think you need help with one thing, or you just want to do the one thing, right? And he talks about how you can't read the label from inside the jar, because sometimes he'll say, well, how did that make you feel? Or how do you feel? And I'm like, I don't want to talk about my feelings. I just want to tell you what happened, right? But it's exactly what you're saying, like that, it's all part of it. And it's bigger than you think it is sometimes, when you think it's one little thing, and that you really do have to address all the components, and coaches are skilled in that. So thanks. Go ahead, Amber.
Yeah, I mean, I think it's just holistic, right? So I agree. I mean, I'm trained as a therapist, right? So feelings matter, and at the same time, feelings, if that's lopsided, that's also a problem. So when you were talking, Shideh, I thought of, there's this great picture of like a statue that its head is gigantic and it's falling over, right? So it's lopsided. Generally, career-driven people are lopsided in their career, and everything else suffers. That's just very much standard until they decide, like, this is untenable. I can't maintain this life. It's not even fulfilling. So your career starts losing the sheen anyway. And you know, there's moments of emptiness. So you have to kind of do that to get where you are, but it's never the end goal. And the same thing, you know, I worked in weight management and I've worked in eating disorders. I like this idea of like weight, right? It's lifestyle change. Yes, you can have a goal, but and exactly, you want to have metrics, but it is a sense of like they're continuing to move and you're allowing yourself to evolve as a human. So therefore, what once was satisfying, you know, in your 20s to 30, great. Now it's 30s to 40s, depending on where you are with children and not having children, partnerships. And so, and the creativity part. And you know, my thoughts are, people call it woo, but when you psychotherapy, you definitely work with the unconscious. The same thing though in coaching is you're trying to figure out what's the stance that is keeping this problem around. There's usually an unconscious stance, and that's our work, is to get it into the room, because people will say, this is what I want, and they're not doing it. And you're working with smart people, you're working with people who know how to create goals and accomplish it. So you can't just be kind of a problem solver. There's a part that's like, you're an intelligent human, you have an understanding of a lot, but there's something that you're not really being clear about, and you don't know what it is yet. And that's kind of our job, with uncovering, so that alignment moves smooth. Because when you're having a lot of friction, start and stop, that usually is something has to give. And you don't usually want it to be your relationships, and you don't want it to be your career, you don't want it to be your financial income. You also have to be, in my opinion, willing to, as you're moving into, I consider the entrepreneurial journey and really a career journey for most of us in the Western culture, it's very much a spiritual journey. If your career and your life matter as a passion and a purpose versus just, you know, an end to a means. So you're supposed to follow your soul's call. Like, that is part of what's happening. And so that kind of friction and that what's happening is like, what are you not allowing? Because usually there is a letting go of something. It could be identity. My thoughts are there's an over enmeshment with your identity when you are particularly in a noble profession of some sort. So when you're a high achiever in a helping profession, particularly, there's also like, what would people think, right? And so for me, letting go of my private practice in psychiatry, I mean, I took a long time. I wasn't just like, I'm ending. Like, I was like, I have clients to work with, I have patients, I'm not going to just end it, but I want to explore more of my life that's not just kind of sitting with suffering as my full-time job, which is what you're dealing with often in healthcare. And so my thoughts are, you just kind of want to make sure you're really allowing for all of it. You should have some sense of like, you're saying this, are you actually getting it? What's going on behind there? And so woo, in my opinion, is playing with energy, and things are always involved with energy. It's not just physical. And that's how I mean, in healthcare, we know this too, right? This idea that how a person perceives their sense of, an outcome, a disease. That's why it's really important as a provider of any sort that you're not speaking in a nocebo effect, right? If you, and we're again trained like in defensive medicine, we're trained to kind of like everyone's got to know the risks first, right, versus the benefits, and like learning how to speak with people. So we provide hope, we provide reality, and we also provide empowerment, even in healthcare. And I think most of us can do that. But again, if you get kind of like subsumed in the culture of healthcare, you can kind of lose a little bit of your own way. And that's my thoughts about most of us in society. Healthcare is just a big kind of, I'm forgetting the word off the top of my head, but it's basically like it's a larger marker of people not trusting themselves, not really feeling empowered, wanting to be taken care of versus like, can you with me collaborate and really be honest in the room. And part of the problem why when I reached out to you, Kim, was like a fierce advocate for physicians, because there's not enough room. Working in mental health was a lot easier. I had time, but most people don't have time, and you need time with the human so that you're on board with supporting people. So to me, coaching, because so many people view therapy as problem solving and I don't have a problem, I view therapy as it's exploratory. You are on an exploratory journey. I view coaching the same way. It's exploratory. My thoughts were that coaching tends to help people who misidentify support as I'm sick or I'm helpless. High achievers do not like to see themselves as helpless. And so it helps you get support in a way that is empowering versus staying in the model of therapy is the only reason why I would get support. And it isn't the same, but they both have similar components. Good therapy has coaching involved, and good coaching has therapeutic components, which is basically relational work.
Yeah. To add to that coaching comment, like one of the things, I've given presentations to hospitals, like I do think people think of coaching as like for someone who's broken, like someone like, and it's just such a funny way to think about it because, like you think of Michael Jordan, he was the top rookie of the year. He won Rookie of the Year when he came into the NBA, but it wasn't until like 4 years later that he could actually like deliver on that like talent, until he had Phil Jackson, who was his coach, that like helped him do that. And like everybody who's actually like all people that are high performers have coaches, and it's coaches are not there to like I coach people in tech. Like I didn't even know that Java Plus and Java Plus Plus were two different languages. Like that stuff I get explained to it, but like I help them see where they're not looking. Right? Like I'm not a software engineer. I don't know software engineering, but I coach people in like politics, finance, law, like these fields are different. But the problem that happened is that they're not seeing an aspect of the problem, and they need someone to push their thinking. So Adam Grant's like the guy who always talks, the organizational psychologist, who's like a wonderful thought leader. He says smart people especially have a really hard time rethinking because they're normally right. And so they really need to be pushed on their thinking. And he like in his book, he really discusses the difference between Steve Jobs and I can't remember the guy's name who ran BlackBerry. And why you don't see a BlackBerry anymore is when the BlackBerry guy was pushed on his thinking about putting a browser and making it more than email. He said, no, people just want to be able to send emails from their phone. And Steve Jobs didn't want to go into the phone market because he was Apple wasn't in a great situation. They had the iPod, which was like their savior, sort of in a bad financial situation. They were like, no, you got to do this. And he like finally got pushed into by his team to really rethink it. He then went in full forward with the iPhone, and no one has an iPod anymore. And so sometimes you have to surrender what was the best thing to get the even better thing. Right. Yep. And so it's just something to consider, is that coaching is not for people. It's not like you can do it to solve a specific problem, right? And I think that's the thing, is there's such a breadth of coaching, but I think of it as strategic planning for your own life, like for the whole of your whole life.
Yeah, they're like design thinking too, especially because generally there is that smart component. And so what I always say is I like to talk about architects. So there's like a know-it-all, which is great. It's helped you, but that know-it-all has some blind spots, and it's like having this is the hard part, the humility to say, like, they can see differently because they're not stuck in my brain, right? And so, like, you honor the strength of a brain, but like full bodied, and then with a blind spot. So coaches function as like this little weakness. Like, one, we're going to access your strengths, but that little weakness could be your Achilles heel. And again, that typically does involve you with your impact and your income concepts, and like creating that life that you actually want versus like the good enough life, which could look very successful on the outside, but it's actually not your fullest potential.
Yeah. And what we know to be true also evolves, right? Like what that know-it-all might have known something. Well, here's like a really like concrete example. It's a very small, not like deep subconscious work thing that comes up with a lot of my clients, which is like funny, but it's so obvious when you point it out, but until you point it out, people don't see it. Is that about exercise actually? So I'm a big proponent of movement. I think movement is a really important part of our lives. We know it's an important part of our lives for health, but also just to move our energy. We get stagnant. And so, people say, I feel so tired at the end of the day when I've gone to work that I flop and I just need to rest. And I push them on that. And I'm like, unless you are a manual laborer, you have no physical tiredness in your body, actually. You have cognitive tiredness. You have exhaustion from like your brain, like writing a bunch of emails, solving a bunch of complex problems. But like, unless you're like really doing something physical. And so, yes, when you were a child, when your body felt exhausted, it was because it had been physically exhausted and you did need to rest. But as an adult, most of our exhaustion comes from mental exhaustion. And the mental exhaustion needs you to turn off your brain for a little bit, but it also needs movement to up your energy. And so like, I really push people to like realize that there is that difference. And once you start noticing that and be like, so what I want to push when you come home and want to flop, just be like, I'm going to go for a 10-minute walk and just see what happens to your body. And notice, and then they start noticing, oh, my energy goes up. And they start really separating the idea of physical exhaustion, which many of us are rarely getting. I mean, sometimes I get it when I play tennis, like when I do my classic double bubble gym followed by tennis, I get a little physical exhaustion, but otherwise, most of us are not getting physical exhaustion as adults. We're getting a lot of mental exhaustion. And so really understanding how do we let go of mental exhaustion? It's not sitting on Netflixing or like just like flopping. Actually, that makes it worse eventually. It's just interesting.
I agree. I call that wired but tired, right? Like it's this like you're wired actually, and you have like chronic mental stuff going on, and you're feeling tired. And particularly midlife, and also particularly females, because I think there's that component of the emotion of the hormonal part, right, where it's just like, and why burnout is such a risk more so for females because of some of that, but having to add movement and forgetting that we are animals first, right? This body-oriented approach has to be your priority for recovery. And it will involve, it can be slow movement, it can be fast movement, it can be short times, long times, but exactly, movement is like crucial.
Yeah. And recognizing just like how, and this whole thing about the body that we're talking about, it's like interesting. So I was recently reading something about the amount of data that we are presented, not how much we actually process, but we are presented in a day. And in 2009, it was about 32 gigabytes we would get in a day as an adult, which is about 2 books worth. And in 2019, that number had gone to 72 gigabytes, which is about, or 72, gigabytes. And that is about 16 movies worth of information. But what is really astounding about that number is that 500 years ago, which is nothing in evolutionary terms, a very educated person, that would what they would get in their whole lifetime. So think about, we are just like, our brains are being like assaulted all the time with information. And so it's incredibly important to learn how to, for no lack of a better word, hack that physiology, right? Like understand what we need to do to shut it out for a little bit, because it's a lot, and it is very taxing on your body and on your brain. And movement is definitely part of that equation. There's a lot of other things that are part of that equation, but it's just like important to understand those things from basic science. Like that's, it's not like super woo. It's just like, oh yeah, I do get really distracted. And we live in this highly distractible society. Like, how do you want to parent in that? How do you want to live in that? How do you want to take care of yourself in that? You have to have a strategy for that. And one that works for you. Like, that's it. Like, I don't love like set programs, because, and when I talk about metrics, like I don't like, it's not like all my clients have the same metrics. They are the metrics specific to them, right? Like if you've lost your way and lost your voice, like your metric on that, on how to redevelop your voice is going to be very different than somebody else's metric on something completely different. And it's just really important to really spend some time thinking about, how do I want to move through this life? Like this one precious life I get to live, that I get to do whatever I want with. It's like, it's so fun.
That's great. A couple things that came to mind when you're talking about changing your thinking, as I saw a quote within the last few days, I can't remember where, is something about the light bulb wasn't invented by making better candles and by improving the candle, right? I thought that was good. And I was wondering if doctors might be able to relate a little of like coaching to like intuition, because I think they would all say, well, yeah, like intuition is a thing and they use that clinically, but you can't, see it, touch it, right? But is that kind of related, would you say, like using your intuition?
And the data backs intuition also. Like there's like famous study where they look at senior physicians and they have all these clinical rules, and none of the clinical rules perform better than the intuition of the senior physicians who've been practicing for a long time. I definitely think coaching has an intuitive, but it's also like you're helping people tap into their own intuition about their own lives, right? Like that's the key part, is because we're so busy just doing things and we're not spending time on strategizing how we want to live our life, how we want to do it. The other thing that I see a lot for physicians and healthcare providers in general is that, you've spent a lot of time developing your expertise, and that expertise was developed with self-scrutiny and self-questioning. Wonderful qualities to have. Like that is why we work on getting better and smarter and doing it better every time. However, one of the big friction points is that healthcare has now become very corporate, right? Like there's a lot of and I think sometimes in the business world, confidence is overvalued over expertise. And this is a space where I think physicians and the healthcare providers in general need to really step into their power, because as an expert, like that self-scrutiny is really important, but when it shows up and that self-questioning, right? Like you're looking at all the nuances of why you make policies the way you do, right? But the business end person is like, nope, we're just going to do this thing because we need to make this bottom line. And that's when you have to step in your power as like, no, I'm the expert. I understand patient care. I understand patient needs more, and be less self-critical, because that sometimes that self-criticalness gets in the way of confidence. And so there's nothing wrong with that, like self reevaluation. That's a wonderful skill set, but knowing when to apply it and when to be like, oh no, I am actually the expert. We have to own our expertise for like the good of having good leaders, like good leadership in healthcare, because we need that, right? Like I think I posted recently about something about like, we're supposed to have 15 minutes with people. Like I'll decide how much I need to spend with a patient, right? Like, and like, the mom has 3 kids who like, the third one just coming in for their strep test and just like wants the antibiotics as quick as the other 2 have strep. She doesn't want to spend more than 1 minute with me. She just wants to get the strep test and get the heck out. I understand that. So she needs 1 minute, but the elderly woman who like needs sign language and like can't, like doesn't have resources and now has like zoster of her eye and is like terrified about going to the hospital, she needs more time than that. She needs me to spend time with her, talking to her, counseling her, making her feel safe. And it's my job to decide, not somebody who's sitting in the back, like making sure everybody gets paid. Like I'll decide how I'm going to spread out my time. You worry about, I don't know, whatever you worry about.
Right.
But
Yeah, bingo.
Yeah. So as we wind down the last minute or so, Amber, if you had any closing thoughts for that, or suggestions for patients who wish to support their doctors, and let our listeners know how they can get in touch with you.
Oh yeah, sure. They can find me on my website, The Focus Path, and they can shoot me an email. I'm on social media sometimes. Again, I choose where my attention goes. So yeah, I agree. There is a sense of I really advocate autonomy for anybody, right? So entrepreneurs often have autonomy, and part of where I got burned out was I saw I was my own captor. So some of that self-criticism and those things that allow for nuance, as Shideh said, you can turn it on yourself into a perfectionism model, which will keep you feeling less empowered, and remembering that empowerment, whoever you work with, their goal is to help you feel empowered in your customized way versus, again, like the cookie cutter model. And not that we empower, but we're really just sharing with you, like, these are the things that typically work. Do you want to create a life that is yours, or do you want to live a life where you feel the victim, right? And so you used one of my favorite quotes: you have one precious life, you are meant to enjoy it, and choose what you want.
That's terrific. Thank you so much. And Shideh, how can our listeners get in touch with you? And do you have any last few parting words?
So you can get in touch with me. I'm on LinkedIn. My name is Shideh Shafie. I hope there's in the show notes, but I don't want to spell it.
Yes, I'll put it in the show notes.
And then my website is just my name, www.shidehshafie.com. And that's an easy way to reach out to me. And I just want people to know that, like, there really is, you are in charge of creating the life that you want to live. And it's totally normal to feel exhausted and tired, but there is a solution to that. And there's nothing wrong with seeking help for that. Just the same way that, like, we hire, financial advisors to tell us where we should put our money, or other advisors for all kinds of things. Like, it's good to spend some time building a strategy for your life. Like, I think everyone can do that. You can do that on your own. You can do that with a coach, but sometimes doing it with someone who's going to push your thinking and push you to evolve past your own limitations can be really powerful work.
100%. Well, thank you both so much for being my guests. I loved having
Thank you.
and I knew that I would.
Thank you for having us. It's so fun.
Yeah, thank you. It was
Okay,
great.
you're welcome. So in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.
Yes.
Love that.
Thanks.